AIO breast and lungboard. This set is always based on the zero-angle cushion that is placed on the base plate by locating the green bosses on the bottom of the cushion. There are blue lines on the base plate to help in positioning the cushion. Press the cushion bosses well into the holes so that the base cushion lies flat on the table. Then attach the grey base cushion of the knee and leg positioning set to the zero-angle cushion. Then fit other elements of the knee and leg positioning set. By using the measuring strips on sides A and B, you can ensure that these elements are always placed in the same place for the same patient. After this, the wedges are placed on top of the zero-angle cushion. The wedges have an angle of 5, 10 or 15 degrees. To allow the use of thoracic masks, the secondary base plate has to be fixed to the wedge using the bosses underneath the secondary base plate. The head support can also be fixed to this base plate in the same way. To support the arms comfortably, one of two arm supports can be fixed to the wedge. Various grip poles can be used, but to put them in place, you first have to set up the base element of the grip pole set on the base plate. The base unit has pins that fit precisely in the holes on the cranial side of the base plate. These are then tightened to the block using the two bolts supplied. The grip poles can now be fitted into the holes of the support block. The grip poles have numbers engraved on them so that you can determine the position of the other elements of the set, such as the horizontal or protruding hand grip. Push the horizontal hand grip over the two upright rods to the desired height and fix it in place using the sliding bolt. For the protruding hand grip to be put in place, one support post has to be placed in one of the side holes of the base block and the other in the middle hole. The protruding hand grip is attached in the same way as the horizontal hand grip. The zero-angle cushion and the wedges can always be widened using the side pieces if the patient's anatomy requires it. Special thoracic masks can be prepared on the patient to increase the precision of the treatment. To prepare these masks, first ask the patient to put his or her arms down along his or her side and remove the armrest. This makes it easy to access the grooves in the secondary base plate. Place the pre-cut piece so that the upper part covers the chin. Fix the top catches in the grooves of the secondary base plate. Fix them in position using the blue EVA blocks. Put the armrests and the patient's arms back so that the grooves along the body are accessible. Put the other mask clips in the relevant slots and place the long blue EVA blocks. This allows 4-point, 5-point asymmetrical and 6-point thorax masks to be made.